So good morning to our viewers and clients. We're coming to you live from Savannah Healthcare Services. Savannah Healthcare is a private facility within Nairobi. We have a branch at Pioneer House, Kenyatta Avenue. We have another branch at Upper Hill, Mara Road, opposite CIC. And our third branch is at KCB, Kencom House along Moi Avenue in town. We have a wide range of services, including general practitioner consultation, obstetric and gynecology consultations. Other specialized services include physician, ENT, surgery, and any other consultations like pediatrics. We have specialists available for such services. We also have laboratories and dispensing chemists in all our branches. So today we are here, we want to talk to you about the cancer of the cervix. We know that October is a cancer awareness month, and we want to be able to walk this journey with our viewers. So one of the ways is by letting you understand what cancer of the cervix is and what are the things that you can do to be able to protect yourself, and also should you find yourself unwell, what can be done for you so that your health can be restored. So with us is Dr. Wachira Murage, our lead obstetrician gynecologist. Welcome, Daktari, to this session.
Thank you, Mary.
Yeah, so in terms of introduction, maybe Daktari, you can highlight to us in anatomy, where is the cervix placed in the reproductive system of the female?
Thank you very much. The cervix is in the outer reproductive system. It's the one that is in the vagina, that is the birth canal on the lower aspect. So it's the lower most part of the uterus, and that is the area called cervix, which is really exposed to a lot of problems. For example, infections. The cervix can get infections, and of course it also suffers trauma during birth and sometimes during examination. And of interest now for our topic today, it can also be affected by cancer of the cervix, which now become very, very common. And I do think now it's the leading cancer in women, cancer of the cervix.
Very well, Daktari. So what really happens? When do we start saying that there is cancer? How does it come about for us to be able to say you've developed cancer of the cervix?
Thank you. Cancer of the cervix is a very, very hideous cancer, as all cancers develop slowly over time. So they can start small, and then they grow and become a cancer. When they are very small and in early stages, you're not able to tell because there are no signs and symptoms. But as it grows and shows off, you may have now some pelvic pains, some back pains. Number two, you can have some abnormal foul-smelling discharge, which is blood-stained. And for the ones that are sexually active, then you can have what we call post-coital bleeding. They start having some bleeding after sex. So once you start seeing such things, some unexplained pelvic pain, back pain, some others, some discharge foul-smelling, which has some blood mixed with some blood, or you see some blood after sex, or some abnormal bleeding, do not take for granted. Have it checked.
Thank you for that, Daktari. So what are some of the causes of cancer of the cervix, and are there any risk factors? Are there some people who are highly susceptible than others?
Thank you very much. Cancer of the cervix has no cause, just like any other cancers. But we now know, and we can say with certainty more than 75%, that cancer of the cervix is caused by human papillomavirus. So that is what we think that is causing cancer of the cervix. In fact, in some quarters, it's now graded as a sexually transmitted cancer because of the association of human papillomavirus. There are risk factors in cancer of the cervix because that is what is more important, and this is the causation, what we call in our terms etiology, what we do think about people who are most susceptible to cancer of the cervix. Anybody who is sexually active, whether once or many times, then they must be able be screened for cancer of the cervix. People who have multiple partners, they have to be screened. And of course, people who have gotten recurrent infections, they must be screened. Other people with other diseases like diabetes, hypertension, uh, cancers, HIV, all the diseases and treatments that can cause reduced immunity, those people have to be screened. But by and large, it's really a behavioral, a sexuality issue. And anybody who is sexually active, a lady that is, has to be screened for cancer of the cervix. So multiple sexual partners, frequent STIs, multiple sexual encounters, and we find it more in the girls who start sexuality very early. Yeah, they are more susceptible to cancer of the cervix.
Uh, well elaborated, thank you for that. So as someone, when they realize they have now the symptoms and they have come to visit the doctor, how is the diagnosis made? How is it confirmed that it's true this is cancer of the cervix?
Thank you very much. The health professionals, we normally have what we call in medicine high index of suspicion. If you find someone coming in and they have a foul smelling discharge, if you have someone coming in, they have irregular menses, abnormal bleeding that they cannot explain, or they get their discharge with blood stains, or they have some pelvic pain that you cannot explain. You do an ultrasound, you examine, you cannot explain those back pains. Those are people that you suspect postcoital bleeding, yes, and there's normally a confusion. Some people, some ladies will be on progesterone only contraceptives, like the injection. Those ones do not cause cancer of the cervix. But what they do, they can mask, because one of the side effects of those contraceptives is to cause some irregular bleeding. So anybody who is on those contraceptives and they have irregular bleeding, they must make sure that they are regularly, every 2 years, they are regularly checked for cancer of the cervix. So that kind of a history is what now informs us that there's a high index of suspicion from the history given, and then you go ahead and examine. I know that most of the girls, most of the ladies are very, very scared of a speculum examination, what we call gynecological examination, because it involves putting in the fingers into the private area or using something called a speculum. And that speculum is what now we put into the birth canal of the lady, and then you can look at the cervix and then do a pap smear. When you're looking, you are able to say, am I seeing an obvious lesion? Am I seeing obvious cancer? Am I seeing an obvious swelling? Am I seeing an obvious, does the cervix bleed easily when it is touched? Sometimes you don't see anything, but you go ahead and do a pap smear. Very, very simple procedure that takes a short time. In the periphery, there's something called via villi, where you just stain with iodine, acetic acid, and the changes that you look at, the changes that those dyes bring, you'll be able to tell you whether you're seeing cancer of the cervix or there's a suspicion. Then you can go to pap smear, and then you can go on to other forms of diagnosis. But pap smear is normally the first, point of diagnosing cancer of the cervix. Once you have those results of the cancer of the cervix, then you can either be told your pap smear is normal, hurrah, and that is very good. We normally advise you for routine care, that is after 2 years. They can tell you maybe there's infection in the cervix, then you treat the infection. They can tell you we are seeing some cells that do not belong to the cervix. What do we do about them? Then you can repeat after 3 to 6 months, then you repeat another pap smear. Or they can tell you we are seeing some slight changes, you do the same. They can tell you you are seeing HPV changes. Then these days you can go to the blood and do what is called a HPV DNA. Alright? If you find that there are some very suspicious cells, then you can do a test that we call colposcopy and biopsy. So you want to get a piece of meat, because remember, pap smear is something superficial. Alright? But when you now want to get deeper into the tissue, then you do a biopsy. You get bites from the cervix, and those bites you take them for histology. They'll give you more information. and you'll be able to make a diagnosis. Wherever you see an obvious swelling, then you can get a mass from that swelling. If they confirm that that is cancer of the cervix, then you can go to theater and do something called an EUA examination and staging. This is where you have the opportunity now to feel the other organs. Yes, because the cancer of the cervix spreads locally. Then it goes to the rectum, then it may go up to the urinary system, to the bladder, and then all the way to the kidney and other areas surrounding the cervix.
Alright. Actually, you know that the general population feels like the moment you've been told that you have cancer, it feels like a death sentence and there's a lot of scare. So please take us through the journey of treatment, what happens, and then also you could enlighten on in the recent past we have seen young girls being vaccinated. How does it work?
Thank you very much. When you're talking about prevention, you're talking of that vaccine against HPV, the HPV vaccine. And I know there's been lots of politics brought into the vaccine. But what I can say is the vaccine helps a lot, especially done in the girls before sexuality. And that's why we say about age 9, 10, we can be able to vaccinate those girls. It really helps as a sort of a prevention. Of course, the other prevention is the morals, right? And the behavioral change, that sex before marriage is not good because it exposes you not only to cancer of the cervix, other diseases like HIV and other sexually transmitted infections. So prevention, good behavioral, morals and all those things are good in preventing cancer of the cervix. And of course now the vaccine is very, very important. So once you have made a diagnosis of cancer of the cervix, you have gone to theater, you have done EUA, staging and biopsy, it has come back. So you are able to say, from the way I felt, this cancer was stage 1, stage 2, stage 3, stage 4. The area precancerous lesion, that's what we call HCL. You see the doctors are abbreviating as HCL. Those are very early cancer stages and carcinoma in situ. This is where you cannot feel any cancer, but the test have told you there's an early cancer. Then you can do some treatments, like what we call loop excision of the transformation zone. That is basically where you cut a portion of the cervix. You can also do cone biopsy so that you cut a larger portion of the cervix. You can also use ice, yes, and burn and try and kill this, especially if it's a young girl and they have not had children. You can buy time and as you do those. But where there is frank cancer, then you want to do a more definitive. Stage 1, stage 2A, right? According to now that EUA and staging, those ones are amenable for radical surgery. And radical surgery involves moving the cervix and moving other areas and going up to the nodes. Then followed by radiotherapy and chemotherapy. From stage 2B onwards up to stage 4, because we are saying now stage 1 is localized in the cervix. Stage 2A, they are just next to the cervix. B, they have moved up to the cervix a bit. 3, they have gone to the bladder and next there. Stage now 3B, it has gone to the ureters, and we are talking now of stage 4, it has gone to other areas. So when it is 2B and above, then you cannot do surgery. Because surgery will not help, you're not able to get to the margin. So those are the patients now you go for radiotherapy and chemotherapy. And then it's a long-term process. Yes, because they have to undergo counseling, both the individual and family, because of the follow-up. And you have to be seeing them depending on the treatments that you have given. It's a long life kind of a follow-up for such patients who have undergone either surgery, who have undergone radiotherapy or chemotherapy. Radio is using the radiation and chemo is using the medications.
So thank you for that, Dr. You've given us really good tips, and it's clear that the mainstay of diagnosis is pap smear. And just as we finalize, you mentioned counseling. What other things do you do in your part of the doctor to help see that these patients, as they undergo these kinds of treatment, they kind of maintain their quality of life?
So we make sure that they have nutritional counseling. And here at Savannah, we ensure that we have a nutritionist, we have a psychological clinic going on. So we make sure that their dietary is taken care of. We ensure that their counseling to be able to even cope is taken care of. We like to emphasize the importance of pap smear. A sickle cell of cancer of the cervix takes about 10 to 15 years to finally blow up into cancer and move out to other areas. So if we come early and you're able to do pap smears early, then you're able to assist that particular lady not to get into those stage 3B and onwards, which cannot be amenable for any treatment for the prognosis. Because remember, in cancer, we do not talk of curing, we talk of prognosis. Stage 1, stage 2, those ones have very good prognosis. Actually, the survival rate is very high. 5-year survival rate is more than 80%. But as you go, then it comes down to 50. Stage 4, we might talk about 10% 5-year rate survival. So we are talking of the area we get the diagnosis, the area, the stage in the cancer, then we are able to help such a patient.
So thanks a lot for Daktari for that eye-opening discussion. I hope you all learned something about the cancer of cervix. So as we finalize, I just want to remind you, like I said in the beginning, that Savannah Healthcare Services is open for all of us. We have a gynecologist every day, Monday to Saturday, and they'll be able to do pap smears for you so that we can walk the journey together. So thank you so much.
Thank you.